Okay, this is a video that just summarizes prescription drugs that contain fluoride. And the point I want to make is, if you've heard me talk before about fluoride, fluoride's basically rat poison. All that stuff about it being good for your teeth is mostly nonsense. There's some studies show it might have a very small benefit for your teeth. There's plenty of them show that it appears to have almost no benefit for your teeth. The best dentists, that I've read their books, they think it's worthless for your teeth. So don't ever use a toothpaste that has fluoride in it. Don't ever use a mouthwash with fluoride in it. Don't ever let your kids get dental cleaning with fluoride. It's just a big fake, okay? It's been put into the water for prisoners to make them docile and stupid. And it's put into the tap water, in my opinion, for multiple reasons, none of them good. Lowers IQs, makes the population docile and stupid. It also lowers fertility. It's a mitochondrial inhibitor. It's a terrible substance. It doesn't belong in the human body. You don't want that in your tap water either. That's why it's good to have reverse osmosis water filtration. You can even use distillation, but that's a little bit more of an involved topic. So I just want to show you some common medicines that contain fluoride. I would recommend, if you have a choice, avoid these. Don't get me wrong, discuss it with your doctor, but just be aware. Statins like Lipitor, Atorvastatin, Crestor, they've all got fluoride in them, and fluoride's a mitochondrial inhibitor. Statins are mitochondrial inhibitors, I'm not a big fan of them. They increase the risk of diabetes. Why not just be a low-fat vegan? Anti-lipemic drugs like Zetia, acetibimine, some steroids like Decadron, dexamethasone, some non-steroidal anti-inflammatories like Celebrex, most selective serotonin reuptake inhibitors like the famous Prozac, also known as fluoxetine. If you see flu in the name of a drug, that implies that it's probably got fluoride in it, okay? Lexapro, Paxil, paroxetine. Prozac is so toxic, there's even papers suggesting it could be used for chemotherapy. A stupid freaking drug. And it got so hyped, irrational exuberance off the charts when it first came out. Antipsychotics like risperidone, Haldol, Prolixin, okay? Fluoroquinolone antibiotics, Levaquin, ciprofloxacin, all the versions of it. So why would so many drugs have fluoride on them? The reason is it binds very tight. It'll replace a hydrogen, and it makes the molecule less polar, so it'll facilitate traversal. If you're trying to get an antibiotic into the gonads, fluoride will help it get in there better, into the prostate. Fluoride will help it get in there. Across the blood-brain barrier, fluoride will help it get in there, like with all these psychiatric medicines. Okay, so they often pull it like on benzodiazepines, Mother's Little Helper, flurazepam, Dalmane. Some antifungals, fluconazole, diflucan, okay, voriconazole, nasal spray, Flonase. Some cardiac medicines like flecainide, okay. Antacids like Prevacid, the old Propulsid, I think that's not on the market anymore. HIV drug, Tipranavir. So anyways, I say this because there's tons of medicines that have fluoride in them. Some people estimate as many as 25% of them. I've given other lectures where I go through what drugs are mitochondrial inhibitors, and I found almost 100 of them, okay? And then, there's what drugs are associated with increased risk of atrial fibrillation. Again, I got about 100 of them. So what I'm trying to say is, drugs are dangerous. Don't take anything unless you really know what's in it, you've read the potential side effects, and it's clear that the benefits outweigh the risks. Discuss it with your doctor, but I'm just sharing this with you to give you a sense of how ubiquitous these dangerous toxic substances are.